and I'll keep chugging, hopefully survive the hour. I will briefly touch on a couple of things. So number one is, should women be even trying to get pregnant right now? So this is a really important topic, and hopefully you'll throw out some likes for this one because this is really critical for everybody. So this is very, very confusing because the Canadian Fertility and Andrology Society, the American Society of Reproductive Medicine, and ESHRE, which is the European Society of Hormones and Reproductive Endocrinology, all sent out missives or statements or guidelines saying, A, do not get pregnant during this outbreak, this viral outbreak, this crisis, and B, it's safe for pregnant women to go to work. So this makes absolutely no sense. I don't understand how we can tell people you can't get pregnant, but you're safe to be pregnant and then go to work. And I've had this discussion with my colleagues. I haven't really gone up to the level of discussing it with the societies, but the reality is it's inexplicable. Like, you can't rationalize those two statements. It's either not safe to be pregnant, in which case if you're pregnant you shouldn't be exposed, so women that are working shouldn't be working, or if it's safe to be pregnant and be working and be exposed, for example in hospital circumstances, then it's really hard to justify telling people not to get pregnant. So when you look at the data for this, obviously it's not adequate. We have only limited information. It's all out of China. Nothing has come out of any of the other cities or areas yet because it's happening so rapidly. But the data from China basically said that pregnant women do not seem to be at an increased risk of contracting or becoming infected from the virus. And they also stated that it does not appear to be transmissible to babies when they are born. Now, yes, there are 1 or 2 cases worldwide, but there have not been a lot of cases of transmission. And the suspicion is that those are actually happening during the birth process. It's not happening to the baby while it's in the womb. So when you factor all of that in, it looks like the virus does not target pregnant women, sort of more so than anybody else, and pregnant women do not appear to be at an increased risk of complications from the virus so far as we know. We've talked about this on the show in the last couple of weeks. We all know that there are increased risks of respiratory compromise when you are pregnant, but they're not seeing that in terms of increased risks of pneumonias or increased risks of ICU admission or anything like that in the pregnancy group. So with that in mind, all of the European, including the UK Society, which initially said pregnant women should not be working past 28 weeks of age, they've now said that if you don't have to work, that you shouldn't, but that if you do have to work, you can, and even if you're in a hospital setting where there is exposure, that it is not optimal, but that it is safe. Same thing is being said by the Society of Obstetricians Gynecologists of Canada, and the same thing is being said by ACOG, the American College of OBGYN in the States. So with all of that in mind, it's looking more and more like they're saying that it's okay to be pregnant and be around the virus. Obviously, we don't want anyone infected, and you need to take precautions. But if it's safe to be around the virus, it's got to be safe to get pregnant. So we are going to ease our restrictions here at the clinic. We are going to space you guys out tremendously. Definitely no one coming in within an hour of anybody else. We've invested a ton of our resources into some very high-end plasma air filtration systems, and they are placed strategically to clean the air. It is proven to kill the virus. And we are all wearing masks when we're in here during the daytime. So we are making sure that between sanitization, glove wearing, mask wearing, and using these air filtration systems, that we are taking really good really good care of the air and of everybody that's coming through here. So I think it's safe to proceed gently. We're not starting up our IVF program yet because that involves going into other clinics right now for us. We are in the process of setting up the lab. I think we'll be up and running very shortly. But because we would have to go to some downtown Toronto centers right now, I don't feel comfortable doing that quite yet. And so we're going to give it a little bit more time to see that the crest of the viral infection has fallen and that you guys are all kind of coming back into a reasonable frame as far as the safety safety of all this is concerned. So yes, we're going to start doing insemination. We have continued doing testing. We will do your teaching, which can all be done virtually, thanks to our amazing nurses. And God bless Lisa Hogan, who's now joined us as well. Amazing, amazing young lady who's one of our newest hires, and she's a great find. So really excited to have her on board with us as well. So we are going to go ahead and start treating people. And yes, I think it is reasonable to tell you guys that if you want to get pregnant, you can go ahead and get pregnant. Because again, the initial statement that you can't get pregnant, but you can work makes no sense. And all of the societies have come out saying you can work. So that kind of automatically rescinds that earlier statement. There are concerns about overwhelming the healthcare system. I think realistically, a few extra people getting pregnant at this time when a lot of people are getting pregnant. If you saw my recent Instagram post, the pregnancy test purchasing has gone through the roof. So obviously there are more pregnancies occurring. So realistically, I think adding a few more people who are infertile and quite desperate to get on board with things is completely reasonable. So yeah, go ahead if you want to try. That's perfectly fine, guys. Okay, so with that, I am going to take some questions. I'll skip back to Instagram and then we'll go from there. I think that was our first one there. Yeah. Okay. So how early is too early to test for a positive pregnancy test when trying naturally? Can testing 4 days prior to my cycle, also what brand test do you find are most accurate? Okay, so I don't actually believe that testing brands make a huge difference. Anything you want to use is fine. You don't have to spend a fortune on pregnancy tests. So that's perfectly fine. As far as how early, the earliest you might be able to detect with a home kit is probably somewhere between 8 to 11 days, 8 being really, really early, 11 being pseudo reasonable. Typically, they want you to wait till you're about a week late, which is almost 3 weeks from when you've actually made the baby. So 4 days prior to your cycle would, on average, in a 28-day cycle, be about 10 days. So you're getting pretty close to that 11-day mark, and that should be perfectly reasonable to do. Question. I am currently 8 weeks pregnant and also just tested positive for the COVID-19. Oh, wow. Are there any new info if the baby would be affected? Okay, so first of all, best wishes. I hope everything goes well for you. Tons of fluids, tons and tons of vitamin, as much natural stuff as you can get. And absolutely immediately present to a hospital if you are not feeling well. On top of that, make sure you are quarantining and anybody around you is quarantining as well. So there is no data at all that you are at a higher risk than anybody else. And as well, it looks like your baby is definitely protected as far as we know so far with the data that's come out so far from what we call vertical transmission. Vertical means from mom to baby. And so it does not look like that transmission is occurring at least through the pregnancy. There may be a chance that babies are getting it during the delivery time. I don't think that's going to be a concern for anybody that's getting it right now unless you're very close to delivery. Hopefully we are kind of, as I said, peaking. New York appears to be stabilizing. Obviously the hotspot worldwide right now, as well as Spain. So if that's the case, we may be seeing a turnaround in this virus, and hopefully we'll all be safe again fairly soon. So you're not at a higher risk if you are pregnant. Your baby is not at a higher risk if you are pregnant. So that's all pretty sort of hopeful. Is there anything additional you can do? No, there is nothing you can do once you've tested positive. Just lots of healthy, normal stuff. Get your fluids, get your vitamins, and isolate, quarantine completely. Anyone that you have had contact with also needs to quarantine. Okay, let's do some Facebook ones. Hi, being a nurse on the designated COVID unit should I postpone starting my IUI cycle? I'm supposed to come see you early May to start the process again. No, I don't think you necessarily need to postpone. As I mentioned just now, it does not look like it's a huge issue as far as being early pregnancy and on a COVID unit. The Royal College of the UK's guidelines are really good for this, and they have quite an extensive set of data. And very clear instructions. And while they initially said stop working to all the women, they then about a few days later re-clarified that and said no, it would be ideal if you're past 28 weeks to not have to be exposed, but prior to that it's perfectly fine, so don't worry about that. Okay. Hey, Dr. Victory, my sister is having a scheduled C-section on May 13th. Will they let her hubby stay with her while at the hospital? Yeah. Windsor Regional Hospital has not shut its doors to family. So you are allowed one person who can stay with you, and we are still doing that, and there has not been any change as of yet. There are no plans to make any changes. Our obstetrical head and David Moucher, the CEO, have both said that they have no plans to do that, and so you can certainly join us. I did a C-section this morning for a lovely young lady whose husband is unfortunately stuck on the other side of the border in Detroit. So he got to FaceTime, and you guys are amazing. My heart goes out to you. I wish he could have been there, but obviously we're all dealing with this as best as we can. So her mom was with her, and they got to FaceTime through the whole experience, which was really, really cool. So thank God for modern technology. Just think a few years ago, we wouldn't have had this stuff. So pretty awesome. To help with pregnancy weight during quarantine, weight gain during quarantine, how much outdoor walking is safe right now? Currently 7 months, avoiding all people and still following social distancing. Yeah, I mean, your distribution of air is huge when you're outside. So I mean, if you're staying far enough away from somebody and they're not coughing and sneezing and hacking and that kind of thing, your risk of catching the virus is minimal. Would I wear a mask? Yes, I would actually recommend you wear a mask, even if it's just a scarf or a a formal mask. But you don't need to worry that much if you're outside for a walk. Now, if you're in downtown New York and you're crammed in like sardines walking around, that's obviously a different situation. But not a major issue for patients who are out like for a residential area walk and you're not bumping into other people. That should be perfectly fine. So go ahead and walk to your heart's content. Best treatment for hypothalamic amenorrhea. Wow, that is too loaded a question. It depends on why you are hypothalamic amenorrhea. Hypothalamic amenorrhea can occur because of being too thin, sometimes because of stress or anxiety. There can be hormonal issues, so it depends on which one it is. Depending on, it can occur from an eating disorder, excessive exercise. So the best treatment depends on what your actual diagnosis is. I would need more information. Feel free to reach out to me or set up a consult, and I will be happy to chat with you about that. Okay, so I am going to go back to Instagram for a second. What is high level defined as? Oh, hello, I just spoke with you. High level in this study, we had a great talk yesterday. I will tell you what high level in this study was defined as. Okay, so they said that high level physical activity, where did they report that? Right here, to reflect the intensity, summed as follows. They calculated it using metabolic equivalents and the number of hours that you walked briskly or any equivalent activity. So there was 0 to less than 33.3, so it's a calculation you'd have to use. Low was 33.5 to 500, moderate was 500 to 1,000, and high was greater than 1,000. Their metabolic equivalent calculation is based on this specific thing that they do. So it was multiplied, the number of hours was multiplied by 3.33 for walking briskly and 6.66 for doing doing vigorous physical activity like gym type exercise. Okay, this is just for women. I am assuming it applies to men too. Yeah, so they looked at this study in women alone. It did not include men, but we do know for sure that men that have higher incidence of sitting, for example, truck drivers, actually have poorer sperm because the scrotum gets compressed and it increases heat and decreases blood flow, which is definitely not good for the scrotum. We know that guys that are heavy have significant sperm problems because you start producing more estrogen than normal as a male when you're heavy, and estrogen is not particularly sperm friendly. It drops your testosterone production, it drops your estrogen or your sperm production. So we know that there's issues there. And then there's metabolic changes as well, higher cholesterol, higher fat, problems with heat management, inflammation. All of these things are not good for sperm production. So it does apply to men, although this study didn't demonstrate that, but there are multiple other studies that do. Okay, back to here. I have factor V, Leiden, blood clotting factor, and PCOS. I have a referral to my local fertility clinic, but haven't seen them yet. In your opinion, could the factor V blood clotting affect the treatments that may be available to me? That's a great question. Okay, so for all those of you that are watching, factor V Leiden is the most common mutation causing thrombophilia. Thrombophilia is when your blood clots more easily than normal. These patients are unfortunately at a higher risk of having problems like blood clots in their legs, like in your calf muscles, and then those can break off, or pieces of those can break off, and that can travel to your lung, and that can be quite dangerous. So sorry that you're suffering from that. It can impact both your fertility. There are some people, myself included, that believe that it can impact your miscarriage rates. And it can also alter not necessarily which treatments you can do, but how we do your treatments. For my patients who have any kind of thrombophilia, they are all on aspirin and heparin. And certainly if you're doing something like IVF where your estrogen levels are really going quite high, that in and of itself, even if you don't have a thrombophilia, is a risk factor for blood clots. So those patients really need to be very, very careful. They should be on a blood thinner while they're going through IVF treatment. So absolutely, it will not impact which treatments you can do, but it does impact how you do the treatments that you choose to do. How long can someone stay on the Lupron injections while waiting in limbo for an FET? I am so sorry that you are in limbo. Yeah, so 6 months without estrogen, indefinitely if we're giving you back some estrogen and progesterone. So you can be on Lupron for 6 months without estrogen, and that's perfectly safe and fine. After that, you will start noticing a slight decrease in your bone mass, or bone density, and so we like to get you on some estrogen to counteract that effect. Hi, I'm just wondering about your waiting list for IVF funding in Sarnia. I'm guessing that any government-funded IVF is on hold. Yeah, so we don't even know what's happening with the government funding. We've had the help from an amazing local politician. I'm not sure if he wants to be named yet. So one of our progressive conservative leaders in the area, amazing guy, super helpful, and he's kind of championed this cause for us, along with Tarek Ibrahim from Ibrahim Strategies Group, and they are helping us to try and acquire funding for our Windsor location. I am hopeful. I'm hoping the government is listening and that they recognize that our community needs this service, but we have not heard anything yet. A little disappointing because they should have done it by April 1st, but they may be able to pull this together for us, so we're keeping our fingers crossed. Write your MPPs, write the Minister of Health, write everybody. Getting comments from you guys will make a huge difference for us in achieving this. So I definitely think there can be sort of a grassroots level program to help us succeed here, and we need you guys for that. In the meantime, everything is on hold because we can't do any IVF anywhere right now. My funded cycles will be coming from Create until such time as we have access to other funding from another center, because I'm no longer working with the Nahal Fertility Program. So that's what's happening for us right now with the funding. Okay, back to Instagram. Seriously, boss man, even through kidney stone. Yes, I'll tell you guys a quick story. So about, I don't know, 8 years ago or something, I had my first bout with kidney stones. Not fun, not fun at all. I definitely don't recommend it. So it was the night before I had to do IVF the next day. So I actually had a kidney stone. I spent all night in Emerge. My amazing colleague Tom Decly operated on me at about 6:30 at night, removed the stone, put in a stent. I got in a car at 8 o'clock at night and drove to Toronto. God bless my wife. She did most of the driving until about midnight when I had to take over. And then I woke up bright and early the next day and actually did IVF procedures, and then came up and lay on the ground because I was in so much pain. So yeah, so this one is not nearly as bad. It is slowly killing me though. So the kidney stone's not fun. If you ever talk to a woman who's had kidney stones and natural labor with no anesthetic, she will tell you that the kidney stone was worse than the labor. I certainly don't want to ever say that I know what a woman's labor feels like, but if it's anything even close to the kidney stone, I think you women are the most amazing people in the world, because I could not do that for 20 hours or even another hour more than I did. Okay, are you starting new treatment cycles? I am likely going to do some insemination. We're going to space it out. By the time everybody is ready, I think that we will be in good shape. So we are starting to spool everybody up again. Most likely by the end of the month, we'll be starting to do stuff. So yes, we are starting things again. Am I shipping embryos? Okay, so we are getting everything ready to ship your embryos. The problem with shipping embryos is Core Cryo, the company we are intending to use, is saying that they cannot send people into the fertility centers. So at the moment, I would be happy to do it, but we cannot do anything yet. Okay. Hi, Dr. Victory, or hey, Dr. Victory. I am 8 weeks pregnant. Congrats. Ultrasound last week showed live intrauterine pregnancy. Yay. Heart rate 140, but my levels were only 52/23. Should I be expecting a miscarriage? No. If you have a positive fetal heartbeat and it was 140, that's a good level. And miscarriage would normally happen in less than 2% of cases once you've seen a heartbeat, unless there's something else going on like lupus or a history of recurrent pregnancy loss or a genetic abnormality or something like that. So you should be okay, and I wouldn't worry about that at all. So yeah, you should be fine. If you are worried and you are mine, just come in. We can repeat your betas, we can repeat your ultrasound. I never want any of my patients panicked. So if you're worried about anything, come on in and see us and we will help you out for sure. Okay. Hi Mel. 27 weeks this Wednesday, getting a lot of Braxton Hicks. Normal this early. When is it too much and need to worry or go in? Okay. So Braxton Hicks by definition is a non-painful contraction of your uterus. It can be uncomfortable, but it shouldn't be painful. So it doesn't really matter how early or how often you get them, that's fine. But if they become painful and they're rhythmic, like every 5 minutes or every 10 minutes or every 7 minutes, something like that, and they're getting worse, you need to go in. I realize everybody's panicked about going to the hospital these days. Do not be panicked. We're taking every precaution. So go in. If you have a problem, don't ignore it and stay home. You need to go in. And that will take care of you. So Mel, if you're having problems, make sure you go in and get checked out. But if they're just tight or kind of take your breath away, uncomfortable, but not ouch, don't worry about it. You're going to be fine. What are my thoughts on working during this, working directly? Okay, so as I mentioned earlier, if you are working and you don't have to work, then don't. If you have to work, then take every precaution you can. Is it okay to actually be directly exposed? They are recommending, at least from the UK, that if you are past 28 weeks, you should avoid direct exposure. So that would be like nurses in the ICU, nurses in the OR, and so on, or ER. But aside from that, for most people, you're probably safe. And hats off to all of our frontline women who are out there. Lots of likes and shout outs for all of you. You guys are amazing. Thank you for everything that you're doing. Doctors, nurses, aides, you know, I don't want to miss anyone, but all of us and all of you who are doing this stuff and pregnant at the same time, totally in awe. You guys are amazing. So thank you for doing everything you do. We are all better for having you guys around, and you are an example for all of us. Okay, cannabis cream for pain. Does it interfere with your fertility? Can it hurt your unborn child? I don't know about cannabis cream. Marijuana itself is definitely unsafe in pregnancy, and it is not good for fertility either. I would avoid it. And as far as I am aware, there is not any good evidence that cannabis cream actually makes a difference. So I would avoid that. Okay, let me take another one over here. Dr. V, does this mean your Sarnia clinic is going to reopen? My Sarnia clinic is about to reopen, but we're actually moving to our own new clinic, so it'll be open very soon. I've partnered with another gentleman there to help us out. Our nurses are on standby. God bless Carrie and Grace and Tara. And James, our lab guys, and our techs for ultrasound. So I hope they're all well. We are temporarily locked down because of the virus and the construction, but I am hoping we will be up and running again soon, probably in about a week, maybe 2 weeks. Yeah, we will be reopened very soon for that. Hospitals have been banning partners in the delivery room because of COVID-19. Well, the only place I know of where that's true is in New York, and actually the governor of the state of New York said you cannot do that, and kind of put out a statement saying that that was illegal. I mean, obviously we want to be safe. And certainly if there's any risk of exposure in terms of a partner that excuse me, is known to have an infection or a positive contact or something, that's a different situation. But if you guys have low risk and no one's showing any signs or symptoms, we are not restricting your access to having your partner there with you. Can you have the 18 people in the waiting room we used to have before? No, you cannot even have one person in the waiting room. But if it's just your partner, that is not a problem. I also recently found out that you can have a certified doula who is registered with the hospital there as well. So for those of you who want to have a support person there, as long as they are a registered doula, they can be there as well. And they do need to have a certificate, and they need to be registered with our hospital, but they can be there. So don't worry, you're not going to be alone. That's perfectly fine. What is the success rate for ovulation induction for women over 40? What about with one tube? Would you be hopeful with this protocol? Well, that depends on what that protocol is. Ovulation induction just means we're helping you make eggs. So if it's just helping you make eggs, then it depends on whether or not we're using oral medication or injectable medication. Oral meds over the age of 40 alone are going to yield a low success rate. Injectable meds would be a bit higher. Adding in insemination is helpful for sure, but it is challenging when you're over 40. Typically, we try a couple of times, and then if it's not working, we fairly rapidly want you to progress to IVF, because there's definitely a time component at that age. The European guidelines say over the age of 39, try insemination once, and if it's not successful, immediately move to IVF. That's easier to say in Europe because a lot of the IVF is socialized, so you don't have to pay for it. In North America, it's quite different. So again, if you have insurance or you have coverage somehow, go straight to IVF. If you do not have insurance or coverage, a couple of shots at IUI successively, like month after month, totally reasonable, and I would support that for you in order to save you a lot of money and resources. Okay, let me skip back to here real quickly. I've been having daily migraines lasting almost all day and more frequent dizzy spells. Could this be because my hemoglobin is at 84? Yes, Em, that is almost undoubtedly because your hemoglobin's at 84. If it's that bad, we should probably get you a blood transfusion. So contact my office tomorrow and I will set that up for you. Tylenol is safe in pregnancy, so you can use some Tylenol. If you're dizzy, I need you to have some support people around you. Please don't fall or have an injury or anything like that. Any advice for insomnia? Is melatonin safe to take? Yep, melatonin is fine. You can take melatonin, not a problem. And bananas and warm milk, they naturally raise your serotonin levels and they help you sleep better as well. So those are okay as well. So that's perfectly fine. After a surrogate baby is born, will it also be only one parent that is allowed to be with the baby, not both intended parents? That's a darn good question. My gestalt is yes, but I will find out for you. Deb, if you are watching, and I don't think she watches the show, we will ask Deb Parent, who runs our program. So I will let you know. I'll do that as soon as we're done here. Is Restorelax okay to take regularly during last weeks of pregnancy? Restorelax is okay to take anytime. Restorelax is polyethylene glycol 3050, and it's very good at helping you absorb water into your stool, which makes it softer. There is no problems with using that at any point in time. Has Create, the fertility center in Toronto, provided updates on when they are reopening? So to the best of my knowledge, they have not closed and they are continuing. I am just very hesitant because if even one patient goes there and carries something in or gets exposed while they're there, that's a real problem for us and for Create. So I haven't restarted the IVF program yet, but we will soon, I think. Thank you for your answer. You're welcome. What are the risks of IUI versus fertility medications? If they cost about the same amount, should we just start right with the IUI since it has higher success rate? That's a loaded question. So it depends on what your diagnosis is. If you have, for example, unexplained infertility, the medications alone and the IUI alone are not helpful. You have to do them in combination. If you have male factor, you would definitely want to do the IUI. If you are not making eggs, you definitely want to do the ovulation induction. So I can't answer that question because there isn't quite enough detail. If I kind of overall had to say which one is better, that's a tough pick. I would probably say making more eggs, generally speaking, is going to have a higher success rate than just the insemination, but it really depends on a lot of different factors. Is your cervix too tight? What is the sperm quality like? How often are you having intercourse? Is he around often enough? So all of those things are really critical. Sorry if I missed this already. Is your clinic still starting new cycles and doing diagnostic testing in light of COVID? We are doing diagnostic testing. We are just beginning to start new cycles. It'll probably roll out in the next week. FET cycles, no. IUIs, yes. FETs will be a little bit longer, guys, just to make 100% sure that there is no exposure. An IUI is pretty quick. You come in, you're gone. An FET is a much more complicated process, needing a number of visits to come in for that, whereas a lot of IUIs are just show up after you've got a positive ovulation test. So we are going to try and minimize your exposures as much as we can. My husband has no sperm. Please let me know if you have any treatment for that. TIA. Well, it depends on why he has no sperm. So if he has no sperm because there's obstruction, like there's a blockage, there's lots of treatments for that. If he has no sperm because his hormones are not being sent from the brain to the testis, there is treatment for that. Actually, HCG, the pregnancy hormone, works in that circumstance. And if he has no sperm because the testicle has failed, sometimes they can find it on biopsy, but it's actually pretty difficult to get sperm in those circumstances. No question, just want to thank you for your optimism through this pandemic. You're so refreshing and we appreciate you. Well, thank you. Hope you are taking care of yourself. I am doing my best to take care of myself. All of my amazing staff, Tarek, my incredible wife, are taking care of me, and my amazing mom who calls me every day, every morning to make sure I'm okay. And my kids keep me young and healthy and fresh and keep challenging me. So I love you guys. Thank you for being amazing. Lots of likes and shout outs for you guys too. So thank you for the very nice comment. A big heartfelt thank you to all the nurses and doctors at Met. That's our hospital here in Windsor. They were just amazing when we were there this past weekend. Thank you for saying that. Big shout out to all of our frontline healthcare workers all across the world. I am on call Wednesday night. I am not daunted. I am excited to be there for you guys. I want to be there for you guys. You know what? Whatever God has planned for me, I'm good with. So I'm going to take every precaution I can. I'm going to protect you guys. I'm going to protect myself, but I'm there to work for you. And as I mentioned in a post last week, I'm excited about it. I go to sleep every night knowing I went 110% for everyone. And so I sleep well. So I'm good with that. What is my advice for constipation during pregnancy if Restorelax doesn't work? That's quite a turn from what I was just talking about. Yeah, any of the things are normal. So Restorelax is great. Use it every day. But Dulcolax, Seneca, Lactulose, they're all safe. Glycerin suppositories, fleet enemas, you can use any of those. There aren't any issues with that. Do you recommend different types of exercise during the different phases of your cycle? No, you can use any kind of exercise at any point. Just don't make it too intense. It should be reasonable exercise. If you're doing like super high intensity exercise, that's probably not optimal. We want you to be doing reasonable exercise, but nothing that's like overdoing it. So no like sort of 2-hour HIIT training sessions or marathon running or anything like that. Oh no, the kidney stones. Yeah, the kidney stones suck. Hey, Dr. Victory, I had my first appointment with you a week and a half ago. I know who you are. You might have answered already, but is our testing put on hold? No, no testing is on hold. We're still testing everybody. We go through this crazy process of cleaning in our ultrasound room. We have this air purifying device, which is proven to kill COVID. We cava wipe the bed. We leave time in between each patient. We never have you guys around each other. And I have one of those N95 masks. I'm using gloves all the time. Everything is sterilized, so no, we are still doing testing. There's no problems with that. Come on in for testing. While taking this forced break from COVID-19, I ovulated on day 30 of my cycle. What's up with that? Stress. I mean, I'm noticing on our obstetrics day about a 10-point increase in blood pressure now, just because everybody's like running out of their minds. So, you know, this is stressing everyone. You know, a huge part of the toll of this disease is not going to be just the physical impact. It's going to be the mental health impact on everybody. So stay strong. Make sure you're relying on family, on friends, on prayer. If you're religious, rely on God, obviously. Meditate, you know, do everything you can. Use this opportunity to become better, to become stronger, to become more determined. Don't give in. You never give in. Always fight. So your cycle is probably off because of stress. And that's totally understandable. You mentioned successive IUIs. Does it make a difference if they're back to back? It doesn't make a difference. It just saves time. There's there's no evidence that back-to-back versus a gap makes a difference in terms of IUI. So you can do them back-to-back. Your nurse that took my blood today, this was the third time, and I have to say she's absolutely super. Just had to say thank you. That's awesome, thank you. I'm not sure who took your blood today. It may have been Lisa, and Lisa is awesome. We are super, super fortunate and excited to have Lisa. Yeah, thank you for saying that. And if Lisa, you're watching, a huge shout out for Lisa. Any of you that know her, she's amazing. I am asking how much IVF costs. Okay, so we are now in the process of developing our packages for IVF. Our cheapest IVF cycle, which is a natural IVF cycle, is only $6,000 Canadian. And then we have packages where you can do like sort of a one try with as many embryos or eggs as you can make. We have another package where you can try multiple times. And then we have live baby guarantees for 1 or even 2 live babies, which obviously go up in price because we're guaranteeing you either a baby or your money back. So the lowest point is at about 6. For a standard IVF cycle, it's $99.95. If you're outside of the country, we add on a little bit more. If there's egg donors and surrogates and so on involved, it starts changing the pricing as well. Our prices are super competitive. As far as I know, they're amongst the lowest in Canada and roughly about a third of what it would cost to do it in the US. So if you're a US patient, come on over. We are more than happy to take care of you. Unfortunately, I'm not with you. That's okay, I'm here for you. But I'm on a long Lupron protocol. I'm supposed to do FET end of May. Do you think that's going to happen? End of May, I suspect it will. If not, I'm okay with it. I just want to be prepared. No, I think you probably will be ready by that time. So don't worry, you should be okay. Back to Instagram. I love the back and forth. I feel like I'm at Wimbledon, back this way, that way. Okay, so Dr. Victory, I was supposed to have my monitoring done for April cycle for IUI, but because of the COVID-19, it was suspended. Can I call again in for my May cycle? Yes, call again for your May cycle. We'll be happy to set everything up for you. Thank you. I'll try to chill out a bit more. Lauren, you're awesome, so don't worry. You're totally chill. You are the best doctor one could ask for. Oh, that's sweet. We love you, that's all. Thank you. I love you guys too. I love the opportunity to help people here, so this is really amazing. You guys are very, very sweet for saying that stuff, so thank you. That's really very, very much appreciated. Thank you, and lots of love right back at you. Okay, 1 or 2 more Facebooks. The screen just went blank. Did I do this thing again? I did, yeah.
Oh, you're everywhere. Hold on, let me
I think it's
flip it.
that way. Sorry, guys. Oh.
There you go.
Okay, there we go. Okay, so let me just quickly get through some questions here. Hi, doctor. I did an IUI on injectable stims this month. Did the double IUI. Oh, don't do double IUI, it's useless. 3 days later, I experienced dizzy spells, 3 days in a row. Shouldn't be due to the hormone changes. Double check, but that shouldn't be a problem. But double IUI is useless. We actually did that as one of our fertility factor fictions. Watch the YouTube channel, Victory Reproductive Care. Do not pay for double IUI. It does not help you in any way. If I'm with another clinic, can I move my stuff to your clinic? Absolutely. We are more than happy to have you move your stuff to our clinic. I try and kind of position ourselves as being very hands-on. I do all the consults. You know, obviously I see all the patients, and I try and be as available to all of you guys as I possibly can be. So yeah, our nurses are amazing. Our embryologist is fantastic. So yeah, we're super excited to take care of anyone that's interested in working with us, and by all means reach out to us if you want to join our clinic. Is ovulating on day 17 considered too late? No. Day 17 is fine. If it starts getting past day 18, 19, I start worrying about egg quality, but 17, you're still okay. Love Lisa. We all love Lisa. She's amazing. Bubbly personality, super talented, very, very bright, and absolutely amazing hair. Thank you. Yes, thank you. Starting with Create on Monday. This is so inspiring in these hard times. Thanks. My pleasure. I'm happy to help you guys out. Okay, it is 8:58 and I don't see any more questions. So we are going to wind this down. Thank you all for joining again. I hope you guys enjoyed the show. Fact or Fiction will be back again next. Is it Monday next week or is it Tuesday next week? Can you remember? I think we're Monday next week, but we will post for you guys. Tons of likes. Bring your friends. Super important for us to grow. We want to make sure that we get to as many people as possible. And if you guys have a topic you want me to discuss, we are wide open for that too. So post it on our Facebook or on Instagram, and I will definitely address those for you guys. Have a great night. Please stay safe, self-isolate, and if you've been exposed, quarantine, quarantine, quarantine. And we will beat this thing, and we will get past it, and we will start getting you guys pregnant again very soon. Have a great night, guys. Lots of love, and